The Vorik had always prided themselves on their battlefield medicine. Their combat medics were the best in the galaxy, enhanced with neural implants, stocked with cutting-edge nanite injectors, capable of stabilizing mortally wounded soldiers in seconds. But the war with the Drell-Zon was proving different. The Vorik were losing, and their medics were failing. Wounded soldiers who should have survived with standard protocols were dying. Injuries their technology should have handled were proving fatal. A desperate transmission was sent across the stars, reaching even the primitive backwater known as Earth. The message was clear: the Vorik needed assistance. Not more soldiers. Not weapons. Doctors. It was an odd request, but the urgency in their plea was undeniable. The Galactic Union had long viewed humans as physically weak, technologically behind, useful only in numbers. Their reputation in medicine was barely acknowledged beyond their own world. But the Vorik had no other choice. Their best were dying, and their most advanced techniques were proving useless. When Earth answered the call, the Vorik were underwhelmed. The humans arrived in standard medical transports, primitive-looking by Vorik standards. There were no neural links, no autosurgeons, no advanced biomodification units. Just humans, carrying cases filled with what looked like crude instruments, scalpels, syringes, even mechanical ventilators. The Vorik combat medics exchanged skeptical glances. This was the best Earth had to offer. Dr. Elias Carter stepped forward, an aging trauma surgeon with years of experience in war zones. His team consisted of emergency physicians, surgeons, and specialists from across Earth. They weren't here to prove themselves. They were here to save lives. The Vorik commander barely contained his skepticism. Your kind relies too much on physical tools. We use direct neural interfacing and biochemical stabilization. What can you offer that our technology cannot? Dr. Carter simply replied, let's find out. Their first test came sooner than expected. A Vorik soldier was rushed in, half his body burned by plasma fire, organs failing. A Vorik medic scanned him, then shook his head. His body cannot be stabilized. His systems are shutting down. We will administer pain suppressants and let him pass with dignity. Dr. Carter wasn't listening. His team was already working. Fluid lines were inserted, wounds were cleaned, oxygen was supplied. A Vorik medic stared in disbelief as human hands, unassisted by implants or AI, carefully repaired tissue, bypassed damaged arteries, and stabilized failing organs with precise, practiced efficiency. Minutes passed. Then an hour. The soldier, whom Vorik medicine had already abandoned, was breathing on his own. Alive. Silence filled the room. The Vorik medics, for the first time, had witnessed something they could not explain. Their technology was supposed to be superior. Their methods were supposed to be definitive. Yet here was a human doctor, proving them wrong. Word spread quickly. The Vorik medics, once confident in their superiority, now watched the human doctors with uneasy curiosity. They couldn't understand how primitive tools and manual procedures had succeeded where their own technology had failed. More wounded poured in. Vorik medical scanners determined who could be saved and who was beyond help. Humans ignored those assessments. Patients marked as terminal were rushed into makeshift operating stations, where human surgeons worked with a speed and precision that defied everything the Vorik understood about medicine. A soldier with a severed limb was stabilized using an old human technique, tourniquets and fluid resuscitation. Vorik medics had dismissed such injuries as untreatable, their nanites unable to regrow lost tissue fast enough. The humans didn't bother with regrowth. They stopped the bleeding, fought off infection, and fitted the soldier with an advanced prosthetic. He was awake within hours, speaking, thanking them. Vorik medics could only watch in stunned silence. Another case arrived, an officer impaled by Drell-Zon chitin. Vorik stabilization gel failed to halt internal bleeding. The humans cut him open, manually clamped arteries, and performed surgery that lasted over 8 hours. It was brutal, hands-on, and completely foreign to Vorik doctrine. Yet, the officer survived. The Vorik commander observed from a distance, his expression unreadable. "Your methods are inefficient," he finally said. "They require too much time, too much effort. We heal with speed." Dr. Carter wiped the sweat from his brow. Speed doesn't matter if the patient still dies. The Vorik had always believed in battlefield efficiency, fast intervention, quick recovery, return to combat. But their technology had limits. Human doctors weren't restricted by those limits. They adapted. They fought for every life, no matter the injury, no matter how long it took. Tensions rose among the Vorik medics. Some resented what they saw as an insult to their profession. Others grew fascinated, asking questions, observing procedures. For the first time, the Vorik weren't just treating injuries. They were learning. Then came a test neither side expected: a Vorik soldier, injured beyond even human intervention. Multiple organ failures. A death sentence, even by human standards. The Vorik stood back, waiting for the inevitable. The humans got to work. The soldier was dying. His vital signs were barely registering, his body shutting down faster than any known treatment could counter. Vorik medics had already stepped away, murmuring quiet words of farewell. Their methods had no solution for this level of systemic failure. Dr. Carter and his team didn't step away. They moved faster. Blood transfusions, artificial ventilation, and emergency organ bypass systems were deployed in seconds. Vorik nanits had failed to repair the damage, so human doctors bypassed the need for natural healing entirely. A damaged lung was removed and replaced with a cloned organ, grown in a Vorik medical vat but implanted with human surgical precision. His failing heart was reinforced with a synthetic graft, something Vorik medicine had never needed before. Human surgeons worked tirelessly, hands moving with an accuracy that Vorik technology had always delegated to machines. The Vorik commander watched, arms crossed, his expression unreadable. His medics stood behind him, silent. They had long believed that no one could match their combat medicine, that their techniques were the peak of efficiency. But what they were witnessing wasn't efficiency. It was something else. It was relentlessness. The soldier's vital signs stabilized. Vorik eyes widened as a soldier they had already mourned took a slow, ragged breath. His body was still weak, his recovery uncertain, but he was alive. The room remained silent as the human doctors stepped back. There was no boasting, no demand for recognition. Just another life saved. Another victory in a war where survival itself was a battle. The Vorik commander finally spoke. "Your methods should not work." Dr. Carter glanced at his patient. "But they do." A shift began. Vorik medics, once skeptical, now approached with questions. They asked about techniques, about strategies, about possibilities they had never considered. Humanity had done more than just save a life. They had proven that there was still more to learn. The final test came without warning. A Vorik high commander, gravely wounded in a surprise Drelzon assault, was rushed in. His injuries were catastrophic: multiple organ failures, neural damage, and internal bleeding beyond anything previously treated. Vorik medics assessed him in seconds and made their decision. Unsalvageable. Dr. Carter's team didn't ask for permission. They acted. Standard procedures wouldn't work. The damage was too extensive. So they adapted. Advanced prosthetics replaced shattered bones, Vorik nanits were manually guided through the bloodstream to prevent clotting, and human-engineered bioprinting replicated failing tissue in real time. The Vorik had always relied on their technology to work autonomously. Humans took control, bending science to their will. Hours passed. The operating room was silent except for the steady rhythm of machines and the quiet, precise movements of the surgeons. Vorik medics, once dismissive, now assisted without hesitation. They weren't just watching anymore. They were learning. Then, impossibly, the commander's eyes opened. The Vorik in the room froze. A warrior they had already accepted as lost had returned, not as a hollowed-out shell of cybernetics, but as something greater, living proof that medicine was not about efficiency, but determination. The Vorik commander, the same one who had doubted them from the beginning, finally stepped forward. His voice was quiet. "We thought we understood the limits of life." Dr. Carter removed his gloves. "Maybe you just needed someone willing to push past them." Word spread. Vorik medicine changed. Their reliance on cold efficiency was replaced with something new, a willingness to fight for every life, no matter the odds. And at the heart of it all was humanity, the species they had once overlooked, proving once again that survival wasn't just about technology. It was about refusing to give up.